Did you know that the smoke from a house fire can be just as deadly as the fire itself? In the aftermath of a house fire, the primary concern is often the visible injuries, like burns. But hidden dangers are lurking in the smoke and debris. Two potent gases, carbon monoxide and hydrogen cyanide, are released during fires and can pose serious health risks, even at low concentrations. These silent killers can be undetectable to the naked eye, but understanding them is crucial. This is not only for emergency responders who are first on the scene, but also for potential victims of house fires. By comprehending the fundamentals of these gases, recognizing the symptoms of exposure, and knowing the most effective treatment protocols, we can mitigate the risks and provide timely intervention. Knowledge is power, and in this case, it could be life-saving. Now let's dive into the first of these silent killers, carbon monoxide. Carbon monoxide, known as the silent killer, is a colorless, odorless, and non-irritating gas and also tasteless, making its presence even harder to detect without proper equipment. This stealthy culprit is released during the combustion of various materials, particularly in areas where ventilation is compromised. Its danger lies not just in its invisibility, but also in the insidious way it affects our bodies. Once inhaled, carbon monoxide forms a strong bond with hemoglobin in our blood, creating a compound known as carboxyhemoglobin. This new compound is a poor substitute for oxygen, creating a state of oxygen deprivation in our tissues. It's as if each cell is being slowly suffocated, starved of the vital oxygen it needs to function. This cellular asphyxiation can lead to serious health consequences, some of which can be irreversible. In addition to forming carboxyhemoglobin, carbon monoxide also impedes the release of oxygen from the blood to tissues, compounding the effects of oxygen deprivation. So, with no smell or color to warn us, and a mechanism of action as stealthy as a cat on the prowl, how can you tell if you've been exposed to carbon monoxide? The symptoms of carbon monoxide poisoning are often mistaken for other illnesses, such as the flu or food poisoning. Early symptoms include headache, nausea and vomiting, dizziness, weakness, and altered mental status ranging from confusion to loss of consciousness. In severe cases, victims might slip into a coma or experience cardiac issues such as ischemia or arrest. The symptoms of carbon monoxide poisoning can vary widely depending on the individual and level of exposure, making it a particularly insidious threat. Pulse. Co-oximetry can be a quick, non-invasive screening tool, though definitive diagnosis requires more precise blood testing. Diagnosis is confirmed through blood tests measuring carboxyhemoglobin levels. Levels above 10% in non-smokers and 20% in smokers are considered elevated. The treatment protocol is immediate and involves administering 100% normobaric oxygen via a non-rebreather mask. In some cases, hyperbaric oxygen therapy is used, which can help to displace carbon monoxide from hemoglobin quickly. Hyperbaric oxygen therapy is based on factors such as the patient's symptoms, the severity of exposure indicated by carboxyhemoglobin levels, and clinical judgment regarding the patient's response to normobaric oxygen. Now that we've covered carbon monoxide, let's move on to the second deadly gas, hydrogen cyanide. Hydrogen cyanide is released during the combustion of nitrogen-containing materials found in many household items. Due to its rapid action as a potent asphyxiant, hydrogen cyanide poses a severe risk, even at low concentrations, requiring immediate action upon identification. This includes plastics, insulation, and synthetic fabrics, all common in our homes. When a fire ignites, these items burn and release hydrogen cyanide gas into the air. This colorless and bitter-smelling gas is a potent asphyxiant. Here's what's happening on a microscopic level. Hydrogen cyanide, or HCN, inhibits an essential enzyme called cytochrome C oxidase. This enzyme is a key player in the electron transport chain, a process vital to cellular respiration. Once it inhibits cytochrome C oxidase, hydrogen cyanide halts the electron transport chain, leading to histotoxic hypoxia, where cells cannot use oxygen, effectively suffocating them on a cellular level. This is a form of cellular asphyxiation similar to what happens with carbon monoxide poisoning. So we've learned that HCN is produced during fires, and we've delved into how it disrupts our cells' ability to use oxygen. But what happens when someone is exposed to hydrogen cyanide? Exposure to hydrogen cyanide can cause a sudden headache, nausea, and even rapid respiratory failure. This colorless, bitter-smelling gas interferes with cellular oxygen use, leading to a range of symptoms. While hydrogen cyanide poisoning can present with common symptoms such as headache or nausea, some individuals might detect a unique, bitter almond smell, which can be a critical early warning sign, though not everyone has the ability to smell it. As the poisoning progresses, individuals may experience rapid respiratory failure, seizures, loss of consciousness, and in severe cases, cardiovascular collapse. Diagnosing hydrogen cyanide poisoning typically involves measuring venous blood cyanide levels. A lactate level over 10 millimoles per liter is indicative of significant poisoning. The primary treatment for hydrogen cyanide poisoning is hydroxycobalamin, available in a cyano kit. This medication works by binding to cyanide ions and forming cyanocobalamin, which is then safely excreted in the urine. Alongside hydroxycobalamin, treatments like sodium thiosulfate may also be employed depending on the clinical scenario and resource availability, offering additional options for effectively counteracting the effects of cyanide poisoning. In the face of a house fire, understanding the signs of hydrogen cyanide poisoning and the appropriate treatment protocols is essential. Knowing these signs and treatments can be the difference between life and death in a house fire situation. Thanks for watching Medical Toxicology. Take care.